Hello, welcome to Menopause and You Chat with a Physician. I'm Dr. Beverly Vaughn, a gynecologist at Lankenau Medical Center. Today we're going to discuss disorders of sleep, specifically restless leg and obstructive sleep apnea. To discuss these two conditions, we have with us Dr. Rochelle Goldberg. Dr. Goldberg is the Director of Sleep Services for Paoli Hospital and Lankenau Medical Center. Welcome, Dr. Goldberg. I would like you to first define restless leg syndrome.
Restless legs is a situation where you have a discomfort in the legs. It can be in the arms as well, but it's a creepy, crawly, unpleasant sensation. And the only way to relieve it is to actually move the extremity and keep moving the extremity. It's not change position, I feel better, it's I have to move. And interestingly about restless legs is it is actually a condition that we diagnose in conversation with the person. There's not a specific test, it's I have this feeling.
What symptoms would a patient have?
Usually people will describe it more in the evening. Most often it'll be a problem when they're trying to fall asleep after they get in bed at night. I can't fall asleep because my legs won't let me. But people can experience it other times of day. They're sitting in a conference, they're sitting in a restaurant, they're sitting at the movies, and they can't keep still. So again, it's that urge to move, can't keep still, and again, it can be a significant source for trouble falling asleep.
Can you talk about the causes of restless leg and some of the things that may aggravate restless leg?
We believe restless legs is related to a chemical signal in the brain that doesn't get through that would otherwise serve to calm the legs down. Restless legs, therefore, are mostly their own condition, not caused by something else. But they can be worse in people who have significant diabetes or kidney failure or anemia. Low iron can also aggravate restless legs. So these are things that we try to look for or be careful about in people who might have increased risk. It can be worse around the time of periods, so perimenopausal, even if your periods are irregular. If they're heavy, you can have some iron loss or even anemia, and that can make it worse around the time of periods. Lifestyle things, though, also have an impact. Caffeine, alcohol, and nicotine can all aggravate restless legs, and there are certain medications or families of medications that can worsen it.
Are there other medical conditions that might mimic restless leg?
One of the things we want to be careful about with restless legs is it's not pain. So other pain conditions, certainly joint pain, arthritis, it's a different sensation and it's not relieved with that movement. Neuropathy, the nerve pain that can be associated with other conditions, also it's different and doesn't tend to respond to that movement, and the creepy crawly sensation is different, but we have to ask the questions carefully.
What treatments do you offer your patients for restless leg?
We first look at lifestyle and behaviors. So certainly if anybody has a reason to be anemic, we want to check that. We want to check the iron level because iron supplement may be quite helpful, but you don't want to just take iron because it has potential side effects and problems. I will talk to a person about what their habits are, including that caffeine, nicotine, and alcohol, and discourage excess, as of course we do. But even mild amounts, if a person's sensitive to it, can make restless legs worse. So if you're having that glass of wine with dinner because you went out to a restaurant, you may pay for it later. Just know that you're doing that. When lifestyle changes aren't enough, then we look at medication treatment. And there are a number of medication families that can help restless legs. This is typically a frequent enough condition that we are looking at regular use of medication. Restless legs for many people is a chronic condition. So these medicines aren't fixing it, they're not curing it, they're helping reduce symptoms and improve quality of life.
Okay, now let's talk about sleep apnea. Patients have all heard of sleep apnea. Can you give us a medical definition?
Many people have heard about sleep apnea now. One thing that I want to emphasize is that women are not exempt from sleep apnea, and particularly women in perimenopausal time of life can have an increased risk for sleep apnea. The symptoms include snoring. Usually it's pretty loud, pretty nasty, and times that they're told they don't breathe. There are pauses in breathing, catches in breathing. The person probably doesn't know much about that themselves. More often it's described by a witness. but the person may be aware of waking at night with some frequency. Extra bathroom trips can also be because of sleep apnea. Waking not restored, not refreshed in the morning, of course, can be a lot of reasons, including sleep apnea. Morning headaches may also be more common. And daytime sleepiness, which is obvious if it's severe, but people can be tired, irritable. They may have trouble with focus, memory, processing, and even all that can be related to the disturbed breathing during the night.
How do you make the diagnosis of sleep apnea?
To directly measure what's going on with the breathing, we do a test measuring when the person is sleeping at night, and we're looking at airflow, and we're looking at breathing effort and oxygen level and heartbeat, because those are all the things that would change or shift if the person's not breathing. You make an effort to breathe, there should be airflow. You make the effort and there's no airflow, that would be an apnea. And again, we're adding that up across the night to see how much: mild, moderate, severe.
Are there factors that contribute to an increased risk of somebody having sleep apnea?
Yep, perimenopausal is a time for women that we are at increased risk. It probably relates to hormonal changes of this time of life. Weight gain, which unfortunately many people find to be a problem around menopause, can also bring it out. But even in the absence of weight gain, you don't have to be having hot flashes as part of the sleep disturbance as well. Sleep apnea may still increase the risk for sleep disturbance in this time of life.
Why is it that people should be concerned about sleep apnea?
Apart from the quality of life and quality of sleep, which it can disturb, I think those are under-respected problems, untreated sleep apnea can have significant health risk. And these include heart disease, such as heart failure, heart attack, rhythm problems. It can affect blood pressure, blood sugar, diabetes, and even the risk for stroke. And then, of course, if you're sleepy, there's the risk for accidents, including motor vehicle accidents, as well as things around home and at work.
I think our audience knows about CPAP, pretty common term. Are there other treatments that are available?
CPAP remains a mainstay of treatment because it is high success rate. It works in people who will use it 99% of the time. It's also low risk because it's air under pressure that keeps the path open. CPAP is a continued treatment. It doesn't cure sleep apnea, and really any of the treatments we talk about are not cure. There are, though, mouth appliances that can help. There's a newer device called the Winx, which also goes in your mouth, but it's more of a vacuum treatment. For some people, some nasal inserts to keep the nasal path more open can help. Sometimes it's stay off your back if somebody's really only bad on their back, and of course the ever popular weight loss.
Dr. Goldberg, that was wonderful information, but is there anything else you might like to add?
My two main issues here, we've talked about two of many sleep disorders, that sleep disorders have a serious impact on quality of life, and we tend to assume it's our lot in life. Sometimes as we get older, or many women, oh, I'm in menopause, what do I expect? Don't expect this. If you have problems with your sleep, it may be something like restless legs or sleep apnea or another sleep problem, and it's important to talk to your doctor about it.
Dr. Goldberg, I appreciate your taking time to talk with us today. It was wonderful information. Thank you very much.
Thank you for having me. It's been a pleasure.